Hello and welcome back to Simple Drug Reviews. In today's video, we'll be discussing Helicobacter pylori, a common but important bacterial infection that affects the stomach and is closely linked to peptic ulcer disease and other gastrointestinal conditions. By the end of this video, you'll have a solid understanding of its causes, pathophysiology, clinical features, diagnosis, and treatment. Now let's begin. Helicobacter pylori, commonly referred to as H. pylori, is a spiral-shaped, gram-negative bacterium that colonizes the lining of the stomach. It is one of the most widespread chronic bacterial infections globally and plays a significant role in the development of peptic ulcer disease, as well as certain types of gastric cancer. Epidemiology. H. pylori infection is highly prevalent worldwide, particularly in developing countries. Transmission usually occurs during childhood and can spread through fecal, oral, and oral routes. Key risk factors include poor sanitation, overcrowded living conditions, and low socioeconomic status. Pathophysiology. One of the key survival mechanisms of H. pylori is its ability to produce the enzyme urease. This enzyme converts urea into ammonia, which helps neutralize stomach acid and allows the bacteria to survive in the harsh gastric environment. As a result, H. pylori damages the protective lining of the stomach, leading to inflammation known as chronic gastritis. In some cases, it also increases gastric acid secretion, particularly in patients with duodenal ulcers. Associated diseases. H. pylori infection is strongly associated with several gastrointestinal conditions. These include peptic ulcer disease, chronic gastritis, and gastric adenocarcinoma. Clinical features. Interestingly, many individuals infected with H. pylori remain asymptomatic. However, when symptoms do occur, they may include a burning or gnawing pain in the upper abdomen, nausea, vomiting, bloating, and loss of appetite. In more severe cases, complications such as gastrointestinal bleeding may arise, presenting as hematemesis, meaning vomiting of blood, or melena, which refers to black, tarry stools that usually have a distinctive foul smell. Diagnosis. Diagnosis of H. pylori infection can be achieved through both non-invasive and invasive methods. Non-invasive tests include the urea breath test, which is the most accurate for detecting active infection, as well as the stool antigen test. Serological testing is also available, but is less preferred because it cannot distinguish between past and active infection. Invasive methods require endoscopy, where a biopsy of the gastric mucosa is taken. This biopsy can then be analyzed using rapid urease testing, histology, or culture. Treatment. The treatment of H. pylori involves combination therapy aimed at complete eradication. The most commonly used regimen is triple therapy, which includes a proton pump inhibitor, such as omeprazole, along with 2 antibiotics, typically amoxicillin and clarithromycin. This regimen is usually given for 10 to 14 days. For patients with a penicillin allergy, amoxicillin is replaced with metronidazole. Another effective option is quadruple therapy, which consists of a proton pump inhibitor, bismuth, metronidazole, and tetracycline. Complications. If left untreated, H. pylori infection can lead to serious complications. These include peptic ulcer perforation, gastric cancer, chronic dyspepsia, and in some cases, iron deficiency anemia. Prevention. Prevention of H. pylori infection largely depends on improving hygiene and sanitation. Ensuring access to safe drinking water, practicing proper food handling, and avoiding the sharing of eating utensils in high-risk environments can significantly reduce transmission. To wrap up, Helicobacter pylori is a spiral-shaped bacterium that commonly infects the stomach lining, often starting in childhood. While many people remain asymptomatic, it can cause chronic gastritis, peptic ulcers, and even increase the risk of gastric cancer. Diagnosis can be made using non-invasive tests like the urea breath test or stool antigen test, or invasive methods such as endoscopic biopsy. Treatment focuses on eradication therapy, usually with triple or quadruple combination regimens that include a proton pump inhibitor and antibiotics. Preventing infection relies on good hygiene, safe water, and proper food handling. Remember, early detection and proper treatment are key to preventing serious complications. Thank you for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more medical videos.